My name is Adam Bezos.
And I'm Eve.
And you're watching Therapy with Adam and Eve.
So today we're joined by Eleni, who is a trainee psychological wellbeing practitioner at NHS Healthy Minds. Thank you so much for joining us.
Thank you for having me.
So today Eleni is going to tell us all about her experience of the actual job itself and her kind of experience of application, as this is a very popular role at the moment, with many people kind of seeing it as a pathway to clinical psychology, and obviously the career progression within improving access to psychological therapies itself. It's a really great role in psychology that not too many people know about, but it's definitely gaining popularity in recent years.
So Eleni, is it okay if you could just start off the video by just telling us what a psychological wellbeing practitioner is exactly? Because I know like most people are more familiar with the assistant psychology position and less so with the PWP position. So if you just give us an overview of what the main responsibilities are and maybe how it differs to an AP position.
Of course. Yeah, so it's a little bit different to an AP position. So a psychological wellbeing practitioner essentially is when you're trained up to work with a range of common mental health problems. So you're taught about techniques such as behavioural activation to manage depression, cognitive restructuring, we call it, to look at and manage anxiety. And we also work with things like panic as well and specific phobias. So you essentially work with quite a big caseload of clients and you see them once every couple of weeks, and you'll essentially coach them or guide them through managing those difficulties.
So you mentioned that you were primarily working with anxiety and depression clients. Could you tell us a bit more about the improving access to psychological therapies way of kind of categorizing clients based on the severity of their issues, and a bit more about how complex the presenting problems of the clients you primarily work with?
So IACT is quite unique really. We work with, as a service generally, quite a wide range of severities in terms of presenting difficulties, but a PWP or trainee PWP will work at what we call step 2. So if I talk you through it, it'll probably make a lot more sense. So step 1 is when a client is referred into the service and they're essentially assessed. So we have a little look at what they're presenting with and refer them to the other appropriate step. Step 2 is where we work, so that's when a client is presenting with a common mental health problem. So it's most likely going to be quite mild severity, mild to moderate, so relatively low risk, and usually after maybe 5 or 6 sessions, that client is likely to fall into recovery. Step 3 of the service is a little bit more moderate to severe. There might be a little bit more risk involved with the client, and it's likely to be maybe more long-standing, their presentation. And then step 4 is when you're looking at referrals to other services. So it might be specialist eating disorder services or trauma-specific services, for example. So yeah, generally we work with common mental health problems. So it's usually anxiety, stress, depression, panic, specific phobias, things like that.
Out of those things that you've mentioned, you know, like the presenting problems that you're kind of exposed to, which ones of those have you kind of had the most experience with, and which ones have you found more difficult and maybe quite easier to deal with?
Yeah, so it's interesting at the moment because my training was over the COVID pandemic, so we're seeing presentations that are in line with the difficulties people are having more generally. So I would say mostly maybe 60% of the clients I'm seeing at the moment are anxiety patients. So we're seeing quite generalized anxiety, worry as a presentation, and low mood is another common one as well. So low mood or depression. I think they're probably my favourite to work with, I'd say. I really like working with depression. I just find the intervention quite interesting, and it's just really rewarding to see people move into recovery from that. And I've just worked with one specific phobia client at the moment, so it's spider phobia, which is quite interesting to work with.
That's probably the most hands-on of the like treatments, I guess, like the phobia ones. In terms of the PWP role, so how would it work in terms of career progression? So obviously, I know right now that you're a trainee PWP, and you mentioned you're kind of in the final module, which is amazing. Like you're almost done there. But what would the career plan kind of look like for a PWP, and what are the kind of stepping stones after the trainee position?
Yeah, so it can look quite different really, depending on the person and their interests. But because it's quite a secure career path, that's kind of the reason why I went into it. So if you're a qualified PWP for 2 years, you can then apply for higher intensity CBT training. So remember I talked about step 3 of the IAPT process. You can then move up to becoming a step 3 practitioner. Alternatively, you can, I think it's after a couple of years of being qualified, you can then apply for a senior PWP role. So taking on more supervision of other qualified PWPs and things like that, a little bit more managerial maybe. And then a lot of people will also leave IAPT altogether and apply for the clinical psychology doctorate. I think that's quite a common route for people to take as well. So it can really depend on your interests, I guess. A lot of people will stick in IAPT and then kind of progress upwards, or apply for the doctorate really, and that alternative route.
That's really interesting to hear, especially because I feel so many graduate psychology jobs and mental health jobs in general can be quite unstable. And even though you're, a really talented applicant, you can end up kind of feeling like you're not really progressing anywhere. So it's really great to hear that, IAPT has got such good, such a good career ladder. Obviously, because of this, it's a very, popular position, and because of the clinical experience and exposure it gives you. And because of that, it's very competitive. So I was wondering if you could tell us a bit more about kind of the experience you had prior to applying, and what the kind of general application process was like, your kind of personal statement and the interview, things like that.
Okay, yeah, so I did my, before this actually, I had a few part-time roles that are probably not too relevant to this. I worked in retail for a short while and then at a fish and chip shop, but yeah, not too relevant. I did my psychology undergrad at the Uni of Nottingham, and that was psychology and cognitive neuroscience. And whilst I was doing my degree, I also took on a few voluntary roles. So I was doing a little bit of research with my tutor at uni. I also volunteered for Headway. They're a brain injury rehab charity, which is really interesting. And then a little bit of work for Nightline as well. They're a student-led, student-run organisation that work 24/7. And then after that, it was a difficult period where you're trying to find a full-time job in a very demanding, quite competitive field. So I was searching for a month. While I was also searching, I did an AP role, so an honorary assistant psychologist role in a charity called Momentum Skills. And then I started my assistant PWP role for a year. So I was in the service I'm in now, basically assessing people at kind of step 1 of the IAPT stepped care model, and then fell into my trainee role after a year of that. That's kind of the process really.
Yeah, that's really good. That obviously we understand that it takes so much. Usually, it takes a lot of experience and attempts to try and get a position like the one that you have. But I guess that really makes you appreciate it once you do have it, which is great. If you could just tell us a little bit about the actual trainee course now. So, like, what is the structure of the trainee PWP course? Just in terms of, I know that I guess there are modules which split up the time that you have there. So what is the structure, and kind of what would a typical week look like for a trainee PWP practitioner?
Okay, so yeah, the course is split into 3 modules. So module 1 is all about assessment. So we're basically assessing clients to see what they're presenting with and which specific step they would be most appropriate for. So that's kind of the focus really. You have 1 exam, you have a big portfolio to fill up, and then an OSCE. So that is with an actor or actress, they're acting as the client and you're assessing their common mental health problem. Then module 2 is all about the treatment, so the different interventions. So you're learning how to treat those common mental health problems I mentioned, so depression, anxiety, panic, specific phobias, etc. There is also another exam, a big portfolio to fill up again, and I'm trying to think, I think it's an essay, reflective essay. And then the module that I'm in at the moment is all about adapting your practice to meet the needs of a variety of people. So whether they have specific learning needs or physical disabilities, whatever it might be, you're learning to adapt your practice to suit them. Again, you have another big portfolio to fill up, a couple of essays, and a treatment recording to submit as well. So a typical week is quite varied really. So it's split up half and half between your university days and then your clinical days. So for me at the moment, Mondays and Wednesdays are my uni days. So I'm either on Zoom, basically in quite a big lecture type of thing where we're learning about the different interventions or whatever the topic is at that time, or we're doing a directed learning assignment. So that's basically a piece of work that you complete and add to your clinical portfolio. Then the other 3 days of the week, so it's Tuesdays, Thursdays and Fridays for me, are my clinical days. So that's when I'm actually doing treatment with my clients. So I think it's quite nice to have that mix really. It makes every week quite different. It gives a bit of variety to the work. So it's quite a nice thing about the course.
Yeah, it's nice to hear how varied it is, especially, and I imagine it's really quite rewarding to like learn the theory behind it and then immediately kind of get to put that into practice in your clinical work as well. So that must be really good. Kind of stemming on from that, I was wondering, in your personal experience, what would you say the kind of main advantages and disadvantages of the role? Like what have you particularly enjoyed so far, and what have you found kind of more challenging?
Yeah, so advantages, I would say there's quite a few. It's very rewarding, definitely, like you said there, when you're doing like a psychology undergrad, you're learning a lot of the theory and the academic side of stuff, but the course really does throw you in the deep end in a good way. So you're putting it all into practice, you're seeing your clients recover, which is really nice. And you do create such a therapeutic rapport with so many people. So at the moment, I'm probably seeing about 5 patients a day, which is probably more than other mental health roles, to be honest. So it's really nice to have that variety in your day and meet lots of people. Disadvantages, I'd say it can be quite full on when you're on the course. There is the academic side of things, which is obviously ongoing throughout, as well as your clinical work, which is building up. So at the start of the course, you have about 10 clients, that increases to about 25 at the end. And when you're a qualified PWP, you're probably seeing around 60 to 70 clients overall. So your caseload would be quite high. That can be quite difficult, I think. I guess creating rapport with every single client can be quite hard. So I would say that's probably a downside. Another advantage is, I would say, the clinical supervision. So you have that weekly when you're on the course and when you're also qualified. So you have, I think it's usually an hour every single week with a senior PWP. They'll talk through your caseload, you get lots of advice about what you should be doing. So you feel very highly supported throughout, I would say.
Amazing. Thanks so much for sharing all of that, Eleni. I did just want to say that Eleni also runs a Instagram account called @Psychsia, which basically is kind of an extension of what's been going on here. Like, it's just loads of really useful tips for people who are going through like the PWP role or interested in psychology generally. And I found that channel really useful, like especially some of the tips that you have, you know, for like cognitive restructuring and behavioral activation and stuff. So I would really recommend like people just having a look at that. So that's @Psychsia. But again, thank you so much, Eleni. It was lovely to speak to you today.
Lovely, thank you so much. Speaking to you guys too.